The universal sling is used to transfer from bed, chair, or floor in a seated, reclined, or supine position. Universal slings come in several different fabrics, including mesh, single client disposable, spacer skincare, slip fit, premium single client disposable, and quilted mesh. The same sling application and transfer procedure is used whether lifting with a ceiling or floor lift, from floor, bed, toilet, recliner, or chair, and similar procedures for other fabric types depending upon special features of the sling. We'll illustrate the differences later in this video. This is a universal sling in slip fit fabric and is made of nylon and comfort padding on the legs. Other features of this universal sling include the body of the sling with the smooth side opposite the label placed towards the patient's body, and shoulder, hip, and leg loops for attaching the sling to a carry bar. Within the loops on most slings are destination loops, used for positioning the client and adjusting the amount of recline. This sling also has ergonomically placed handles for grip and control while the patient is being transferred. The sling label lists the type or style of sling, the size, the reference or product identification number, and the maximum allowable weight or safe working load. Remember to always stay within the lowest safe working load of any component in your lift system. The label also includes washing instructions, which are detailed later in this video. Packaged with each sling is a user instruction sheet. Like most slings, universals come in a variety of fabrics. The application of each are very similar. We will point out some of the differences in this video. This is a basic, universal, single client disposable sling. The label indicates "Do not wash." Single client fabrics may be cleaned of light soiling and are meant to be reused by the same patient until the sling shows any sign of damage or wear or becomes heavily soiled, at which time it should be discarded and replaced. Basic single client universals have built-in head contouring and color-coded trim to indicate size. Basic universal slings have only single destination or positioning loops for attaching to the carry bar. The amount of recline is not adjustable with this basic disposable sling. This is a premium universal disposable sling. It has additional features including multiple destination loops within the sling loops used for positioning, padded head support and leg supports, and a mid-back handle to grip and control the transfer. Size is also indicated on this sling by a color-coded trim. Use the color-coded sling sizing chart to choose the right size sling for your patient. Remember that the patient's weight is just the first consideration when choosing a sling size. People come in many shapes and sizes, and it is completely acceptable to choose a size sling other than that indicated by weight alone, as long as you stay within the safe working load and the patient fits safely, securely, and comfortably in the sling. When applying the universal sling, remember the patient will not be sitting on the sling. Most of the patient's weight is supported by the body and leg supports of the sling. The patient's neck and head are supported by the head support. The body of the sling is positioned from the tailbone to the top of the shoulders. Visually inspect the sling before every use. Discard and replace the sling if any signs of damage or wear and tear are found. To place this sling under a client in a supine position, first fold the sling in half with the label on the outside. Roll the patient to their side. Line up the sling with the top of the head of the client to the top of the head support on the sling, with the tailbone of the patient at the center of the bottom cutout. Adjust the sling position to about a hand width from the fold of the sling to the back of the patient. Roll the top fabric of the sling over on itself, tucking the loops in the fabric, and roll the fabric to the patient. Tuck the roll of fabric under the patient and roll the patient to their other side. Then, unfold the sling and roll the patient onto their back and onto the center of the sling. Fold the leg strap fabric underneath itself. Spread your hands over the underlayer of the fabric and pressing into the mattress, push the leg strap under the middle of the thigh, not behind the knee. Grab the leg strap from inside the thigh and pull the sling loop out so that the fabric slides against fabric and unfolds under and against itself rather than sliding against the skin, which could cause skin abrasion. Make sure the leg support is as flat and smooth as possible under the legs to prevent pinching the skin, binding, and discomfort. Do the same thing to the other leg support. To apply in a seated position, raise the head of the bed or ask the patient to lean forward in their chair. Gather the sling fabric at the top of the cutout and tuck to the base of the client's tailbone. Pull gently on the leg supports to fit the edges of the cutouts around the client's bottom. Then fit the leg supports under the thighs in the same manner as done in the supine position. Bring the carry bar into position crosswise to the patient. For safety, try to always keep one hand on the carry bar. Attach leg sling loops to the lower carry bar hooks, the middle loops to the upper carry bar hooks, along with the shoulder loops. Whenever attaching loops to a carry bar, make sure to match the hooks and destination loops on the left and right sides so the patient is raised as straight and level as possible. Lift the carry bar just enough to put slight tension on all the sling loops. Make sure they're well secured on the carry bar hooks, that the sling is well positioned under the patient, and that the patient feels safe and comfortable. If any adjustment is needed, lower the patient and adjust as necessary. There are 3 different ways to support the legs with a universal sling. The crossed loop method is the most common and secure method. Take a right or left sling leg loop and pass it through the locking loop opening at the bottom of the other leg loop before attaching to the carry bar. The closed loop method may be used for hip replacement patients, amputees, additional comfort, or other conditions. Left and right leg supports and loops go under both legs before attaching to the carry bar so that the legs are held together. The open leg method supports the legs apart and can be used for cleaning and catheterization. With this method, the leg and hip loops are attached straight up to each side of the carry bar. This method is used for leg elevation only and not for transfer. This is a premium universal disposable sling, which has multiple destination loops. On slings with multiple destination loops, you can adjust the amount of recline by connecting different loops to the carry bar. To position the patient seated fully upright, attach long leg loops, long hip loops, and short shoulder loops. For the most reclined position, attach the short leg loops, short hip loops, and long shoulder loops. Attach the sling loops to a carry bar in a way that best suits the client's condition, positioning needs, and destination. For example, if transferring to a toilet, it is best to lift the patient in a full, upright, seated position. Once securely positioned in the sling, lift the patient only as high as necessary to transfer them. Transfer the patient to their destination and safely lower. Removing a sling is the reverse of applying it. To remove the sling, remove the shoulder sling loops and the middle and leg loops from the carry bar. Undo the sling leg loops from the locking loop. Fold the leg support underneath itself and pull the leg loop out and away from the patient, sliding fabric against fabric, avoiding sliding fabric against skin. At this point, if in a seated position, gently lean the patient forward and slide the sling up and out from behind them. If in a supine position, log roll the patient to remove the sling. Washable fabric slings should be placed in a mesh laundry bag before laundering to avoid tangling, wear, and damage by washing machines and agitators. Wash in a mild laundry detergent and never use any kind of chlorine bleach. Fabric and loops exposed to chlorine will show a color change and should be discarded. To disinfect, wash at 176 degrees Fahrenheit or 80 degrees Celsius. Tumble dry low or hang to air dry away from direct sunlight. Disposable single-client slings must never be machine washed. Disposable fabrics may be wiped clean of light soiling, but should be discarded and replaced when heavily soiled. For more information, please call us at 866-891-6502 or visit our website, prismmedicalinc.com.